so next one is, what are some causes of having white pus in my gums?
So depending on the condition, right?
Mhm.
Again, white pus could be multiple
Mm,
different ways it
right.
could happen. Sometimes what we normally see in our office is white pus, like you said, the active pus. For example, the definition of pus is, for example, let's say you had a small acne in your face. So when you have
Okay.
an acne and when it starts to kind of get bigger,
Mm,
sometimes you see some kind of a white fluid inside the
yeah.
acne, which sometimes you may be able to squeeze out.
Mhm.
That's the definition of pus. But sometimes we patients get mixed with whether they have pus inside the mouth or not. Sometimes they may see like a little bit of a plaque that's kind of like a little bit slimy, and
Mhm.
they get confused with that slimy material for a pus, which is not really a pus. And then also we also sometimes see when patients have, excuse me, when patients have when patients extensively use some kind of an alcohol type mouthwash, for example, the regular Listerine or the regular mouthwashes, any other brand of mouthwash that you can go down the aisle at your drugstore, you can get. So a lot of these mouthwashes have alcohols in them.
Mhm.
So whenever you use those alcohol type mouthwashes, they have a tendency to peel the inside of your cheek, and they become kind of slimy, and
Mm,
sometimes patients mistake it for like it could be pus, but it's not actually a pus.
mhm.
That could be from the mouthwash. Again, the second thing we talked about
Mhm.
was the slimy material. That is because of the gum disease or the plaque, which you're not probably like not you don't follow thorough brushing techniques or
Mhm.
proper brushing techniques, or you're not going to the dentist on a regular basis. So if you happen to have those conditions, the slimy plaque condition, you need to come see us, or you need to come see an office like a periodontist, or you may even go to your dentist to get that checked out, and they may be able to do either a regular cleaning, or you may need of a deep cleaning. Once they take care of you by doing a regular cleaning or a deep cleaning, everything may be fine. But if you end up needing a deep cleaning, they may do that for you also. But if it ends up being like the real pus that we talked about, which comes out when you squeeze an acne, so that may involve removing a tooth. For example, if it is from the infected tooth, or if it is an infected tooth that involves needing a root canal. So there are multiple ways to do that, either needing a root canal or doing what we call it as an incision and drainage. Incision and drainage, bottom line is kind of squeezing out the pus from your acne. Same thing, we squeeze out the pus from the infected site. And then the third option is if the tooth is infected really bad, then you cannot salvage it by doing a root canal, or you cannot salvage it by doing an incision drainage. You will need to have the tooth removed. So those are the pretty much options. And I know it's kind of a short question you asked us, what is PUT, but this is a long answer to the short question.